I woke up about 1:30 that Monday morning. I was real nauseous. My wife was still up. And she was watching TV or whatever. And I went to sit in bed and I said, look, something wrong. I can't. I don't know what's going on. I said, I'm so sick. I can't. And
I was in the emergency department at the time, and I was asked by some of the nurses to see a patient because he kept passing out. And in fact, that's why they had brought him in. He went asystolic, which means his heart stopped. We did chest compressions on him twice in the emergency department, and in fact the ambulance crew had done a set of chest compressions as well. Each time he would come back, wake up, and then shortly thereafter would then pass out again. We needed to get a pacemaker in him urgently. I called, and immediately one of our general surgeons, who's actually a private practice doc, came right down, helped put in the access. I was able to float a pacemaker wire with the staff in the emergency room, really doing a great job. Time is of the essence, and we got this in pretty quickly. So it was an amazing team effort of both people who work for Bacchus Hospital and also people in the community who really took care of this patient. And then calling the electrophysiologists at Hartford, they immediately took the patient and transfer. He ended up getting a permanent pacemaker and is doing really well.
I think we're able to quickly triage these patients and realize what can be done safely and quickly in a local hospital like Bacchus and what needs to come up to Hartford to get done. Once we make that determination, the patient comes right up to Hartford. We do what we need to do, and then we have the ability to send them back into their community and have the appropriate follow-up.
The Heart and Vascular Institute, as our other institutes, are providing access and expertise in each of our local communities to ensure that patients get the highest standard of care, the quality care that will get the best outcomes for them, while then sending them back home to their community.
I thought the story was a great example of how healthcare really can work when everyone's working together, and it was a great day for us, and it was an even better day for the patient.
feeling really, really good. So much better than I didn't realize I was feeling so bad, but I feel so much better. I mean, more alert. I sleep a lot better than I did. So I go to, like the old saying goes, I go to bed with the chickens and get up with the chickens now. But it's a lot difference.